Good afternoon, everyone. I'm calling to order the Assembly Health Committee meeting of June 9th. We only have one item on our agenda today, SB 277. I want to thank Senators Pan and Allen for bringing this important measure forward. I look forward to a robust discussion today. I want to make a couple quick points on our process. Given the heightened interest in this bill and to ensure a robust debate today, I'm allowing additional testimony beyond our normal committee rules. We will allow 25 minutes for expert witnesses on each side. After we hear from witnesses on each side, we will allow time for members to ask questions while the expert testimony is fresh in their minds. And after members have asked questions directly of authors and witnesses, we will open the microphones for public testimony. All additional witnesses after the expert witnesses speak are to state only their name, organization, or city, and their position. And I'm going to need to hold everyone to that because we have a lot of speakers who want to speak today, and in order to let everybody speak, we must commit to the same rules for everybody. Name, organization, or city, and position. The sergeants will be directing members of the public who wish to speak to the nearest microphone. We'll have microphones both down here on the floor as well as in the gallery above. And the process we're going to be following is first having everyone speak from the floor. And once you speak, you'll be asked to leave the room to make space for others who want to speak. And that space will be filled behind you. And after we finish on the floor, we'll go up to the top to the gallery and then back down to the floor and proceed in that fashion until everyone has had an opportunity to speak. We're at capacity, and we don't want to have any problems with the fire marshal. So in order to make sure that everyone has a chance to be heard, we need to follow those rules. I want to thank in advance everyone for being here today. I know a lot of you have traveled a long way, which I appreciate. So we're going to get started. Senators Pan and Allen, you may open. And as you're coming up, I'm going to take roll. We have a quorum. Madam Secretary, please call the roll.
Bonta?
Here.
Bonta here. Mainshine? Here. Bonilla? Burke? Chavez?
Here.
Chu?
Here.
Gomez? Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Santiago? Steinnorth?
Here.
Thurmond? Waldron? Wood?
We have 11 present. We have a quorum. Dr. Pan, whenever you're ready.
Thank you. Thank you, Chairman Bonta and members. It's a pleasure to be back here in this room again and to see you again. Senator Allen and I are pleased to present SB 277. SB 277 is a bill that protects children and the public from preventable contagions by abolishing the personal belief exemption to legally required vaccinations for enrollment in school. I want to thank the chair and committee staff for your hard work on the bill, and we are accepting the proposed committee amendments as described in the analysis. Thank you. SB 277 is about freedom. Freedom from deadly, crippling contagions.
All right, wait a second. We have a business meeting here to conduct, and that means we're not going to have any comments, laughter, other comments from the audience. We're going to let our presenter present, and then everyone else is going to have a chance to speak. If we don't follow those rules, we're going to have a problem today. So please, no comments, no laughter, no clapping, no booing, no cheering. Listening, please, and when it's your opportunity to speak, you will. Thank you.
Thank you. And I'm disappointed that there's some people who don't believe in freedom here, but SB 277 is about freedom, freedom from deadly, crippling contagions that are now preventable through the science of vaccination. Vaccines are one of the greatest health achievements of mankind. The Centers for Disease Control list immunizations as one of the 10 great public health achievements that resulted in adding 25 years of life expectancy for Americans. The World Health Organization describes vaccination as second only to clean water in reducing the burden of infectious disease. Vaccinations have prevented more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. Vaccines are safe, and vaccines work. The Institute of Medicine, which is part of the National Academy of Sciences, examined the research and data on vaccine safety and concluded that, quote, there's no evidence of major safety concerns associated with adherence to the childhood immunization schedule, unquote. The Cochrane Collaboration, a global independent network of health experts that analyzes research for evidence-based medicine, examined 5 randomized controlled trials, 1 controlled clinical trial, 27 cohort studies, 17 case control studies, 5 time series trials, 1 case crossover trial, 2 ecological studies, 6 self-controlled case series studies involving in all about 14,700,000 children, assessing the efficacy and safety of the MMR vaccine, and showed that there was no scientific evidence to suggest that the MMR is associated with autism, asthma, leukemia, hay fever, type 1 diabetes, gait disturbance, Crohn's disease, the myelinating disease, or bacterial or viral infections. These findings are also supported by the World Health Organization, the European Union, the Centers for Disease Control, the American Medical Association, and other leading medical, scientific, and public health organizations in the United States and across the world. Evidence shows that the disease being prevented is at least 1,000 times more likely to cause lasting problems than the vaccine itself. And there have been no confirmed deaths caused by the measles vaccine, nor any confirmed cases of that vaccine infecting another person. Our country takes vaccine safety very seriously, and extraordinary efforts are made to identify true vaccine injuries and to prevent them. Vaccine efficacy, however, is not only the result of direct protection from receiving the vaccine, but the protection afforded when a sufficient percentage of people are vaccinated, and that's 95% for measles, to prevent the disease from spreading throughout the community, known as community immunity or herd immunity. And that is why every state in the United States, including California, has passed laws requiring vaccination for school entry to protect our children and our community. However, recent events, such as the measles outbreak that began in Disneyland last December, has proved that our community immunity is waning to dangerously low levels due to over a decade of increasing use of the personal belief exemption in too many schools. For example, in 2008, an unvaccinated child was infected with measles in Switzerland and brought it back to San Diego, where measles spread to 11 other unvaccinated children. However, this disease did not spread further because there were sufficient vaccinated people in the immediate community to prevent further spread. However, recent events in California have shown that we are losing this protection. The number and sizes of places with significant numbers of unvaccinated people in the state has grown each year. The pertussis outbreak in 2010 infected over 9,000 people, hospitalized 809, and killed 10 infants. And the Disneyland measles outbreak infected 134 Californians, including 15 infants too young to be immunized, hospitalized at least 20 people, and both have been linked to communities with low vaccination rates and high use of their personal belief exemptions. This is the proof of why SB 277 is needed to protect the public from vaccine-preventable contagions. SB 277 is also needed to protect our most vulnerable citizens. Vaccine-preventable infections are particularly dangerous to people with cancer, transplants, and other immune disorders. These people often cannot be vaccinated for their own protection, and they depend on community immunity to prevent a contagion from reaching them. A mother of a child with a heart transplant shared that her child was sent home from school for weeks because an unvaccinated child with a personal belief exemption was exposed to chickenpox. She asked, why is my child's school made unsafe because of a decision of another parent? What about my child's right to an education? And what of this mother's need to earn a living to support her child and family? Both protection of the public and children from death and disability due to preventable communicable diseases and assuring children with special needs their right to an education are compelling interests to require all students be vaccinated unless granted a medical exemption. Now, unfortunately, the bill's opponents continue to make many misleading and false statements about SB 277 and vaccination, several of which have already been refuted in previous hearings. Opponents repeat fraudulent and retracted studies that autism is the vaccine injury, and that childhood vaccines contain mercury that causes autism. Opponents have made statements comparing vaccination to forced labor and rape, and falsely insinuate that children would be forcibly vaccinated and non-vaccinating parents would be thrown into prison. Opponents have wrongly claimed that the bill takes away informed consent, denies children their education or is unconstitutional. Now, we have worked with this committee to ensure that SB 277 protects our most vulnerable citizens, ensures that every child has an opportunity to receive an education, and protect our constituents from deadly, contagious, and preventable diseases. And sergeants, if you can hand out the material. Okay, thank you. This is why this bill is not only being supported by health groups, a long list of health groups that are knowledgeable about vaccines and diseases that they prevent, including physicians, nurses, pharmacists, optometrists, public health officers, hospitals, and many others. SB 277 is also supported by education leaders and organizations, as we have listed in the handout that's being distributed, including the State Parent and Teacher Association, teachers, school boards, principals and superintendents, school employees, school nurses, the State Superintendent of Public Instruction, and numerous school districts and school board members, because they know this bill is good for schools and students. And many others support SB 277, including child advocacy groups, businesses and unions, local governments, and newspapers across the state. A PPIC poll last week reported 2/3 of Californians say children should not be allowed to attend public school unless they're vaccinated. This majority will not be silent when more people are hospitalized or die of preventable contagious diseases. They will hold us accountable for denying the science of vaccination if we refuse to act. During the measles outbreak earlier this year, Californians saw signs in stores and restaurants warning them that if their family shopped at this business, they may have been exposed to measles. They watched local news reports on TV that people riding public transit may have been exposed to measles. They received notes from their children's school that their child might have been exposed to measles at school. And they worry about the health and safety of their infants who are too young to be vaccinated, their children, and their loved ones. California in the past has seen signs and notices warning of contagions. But with the protection of vaccination, they have not been seen for decades, until now. We do not want those notices to return, and we certainly do not want preventable contagions to return. The facts are clear. Now is the time to act. Vote yes on SB 277 to keep Californians safe and free from preventable diseases. Now I'd like to have my joint author, Senator Ben Allen, conclude.
Whenever you're ready, Senator Allen.
Thank you. Thank you so much, Assembly members, and I appreciate everyone's time and attention on this issue. And I know that lots of people have been weighing in, and I know a number of you have been following the debate on the Senate side very closely. You probably, if you did, you know that what brought me to this story was the fact that my father had polio as a kid and got it before the vaccine became widely available. Folks from his generation can't believe that we've allowed these communicable diseases back into American society. And they all recall when the church bells all over the nation tolled with celebration when they found the polio vaccine that liberated a generation and generations of future children all around the world from the scourge of this terrible, preventable, debilitating disease. I also come to this story as a former school board member who saw our vaccination rates dropping to dangerously low levels in my own school district, was approached by parents in my district to see what could be done to protect the vast majority of kids in the district, and was told there was very little I could do as a school board member to up the vaccination rates in our school district. Now, as was alluded to in your analysis, there was a really rather extensive legal analysis that was pulled together by the Senate Judiciary Committee. I am happy to talk a bit more about that if you like. The courts have been clear over and over again that there is that a bill like this is absolutely constitutional. It's absolutely legal. That goes back to the Jacobson case, 1905, of the U.S. Supreme Court, right up until just earlier this year, the Phillips v. City of New York at the U.S. Second Circuit of Appeals Federal Court that just upheld a similar type of bill in similar type of situation in New York State under federal law. So the issues have been raised and addressed in court after court, and I'm happy to talk about that process as well if you like. I think what we have here is an honest but very profound disagreement. And let me just give you an illustrative point. And that's that I know that a lot of you have probably been receiving notes. I got an email not too long ago that said, you're so intent on getting the kids all vaccinated. Well, would you be willing to be vaccinated? And it really said it all to me, because I would never be a part of this bill if I didn't believe in vaccines, if I didn't fully vaccinate myself, if I didn't feel that vaccines were a critically important tool for public health. I used to work for the United Nations in East Africa, and I was so grateful of the fact that I was able to go to the doctor, get vaccinated, and get the shots to protect me from the dangerous diseases that existed there. I continue to be grateful that I grew up fully vaccinated, that I grew up in a society that actually took the steps necessary to protect our young people, our children, from dangerous communicable diseases that continue to impact people all over the world today. Every single day on planet Earth, 400 people die of the measles, and unless we want to shut down our international airports, stop our role as a global center for international trade and tourism, we're going to have to think about the fact that we continue to keep ourselves, that we are going to be at risk of diseases that exist in other places if we don't take the steps necessary to protect ourselves here. I think essentially I am someone who has a strong civil liberties streak in me. I do think that in the end of the day, though, government has a role to play when one's beliefs, one's actions founded even upon sincerely felt beliefs, start to impact other people. And that's, I think, what we have here, and that's why I've been involved with this bill. Now, as you know, the committee has offered several amendments that we're very happy to accept. They mainly relate to expanding the medical exemption, and that's something that I'm very interested in. And one of the things we've talked about over and over again is how important it is that there be a strong and robust medical exemption so that anybody who has a legitimate medical concern, genetic predisposition, some sort of immunological problem, they can go to a doctor anywhere in the state and get an exemption from that doctor. That's very important to me, and I'm glad that the committee, I think, pointed out some weaknesses in the earlier bill and took some steps necessary to expand that exemption. And I'm certainly happy to talk further about that if you like as well. These are the reasons that I'm here as part of this discussion. It's obviously been a difficult discussion for everybody. I continue to have profound respect for the folks who participate in this debate. I think come to this conversation with a great deal of sincere care and love for their children. I think at the end of the day, it's our role as legislators to look out broadly for the public health needs of the state, and that's what brings us to this day supporting supporting SB 277. And I really appreciate your attention and happy to answer questions as we go along. Thank you.
Thanks. So we have witness and support, of course.
Go ahead.
Thank you, Senator Pan. Good afternoon, Chair and committee members. I'm Dr. Dean Blumberg. I'm Associate Professor and Chief of Pediatric Infectious Diseases at UC Davis Children's Hospital here in Sacramento. But today I'm testifying in a role on behalf of the American Academy of Pediatrics in California and the California Medical Association. And I appreciate having this opportunity to speak about the importance of this bill. Childhood vaccination has been extraordinarily successful, but vaccines do not work 100% of the time. And it would be a lot simpler if vaccines did work all the time. Then we would not even be having this discussion today, because those who are vaccinated would feel secure that they are protected against vaccine-preventable diseases. Depending on the vaccine, however, they are about 80 to 99% effective, and immunity may wane over time. That's why it's important to have as many in the population immunized as possible to achieve the highest level of immunity, so that if an infectious exposure occurs, transmission is limited. In my role as a specialist in pediatric infectious diseases, I see the outcomes of vaccine-preventable infections. I see children in the ICU requiring a ventilator to breathe because of pertussis or whooping cough. I've seen children die from pertussis, from Hib disease, even from infections that usually are mild, such as chickenpox. And when I do see these deaths, it's a tragedy to see these deaths that did not have to happen if children were fully vaccinated and if those around them were fully vaccinated. There's much misinformation about vaccine safety and effectiveness, and I won't go into the reasons for this, but the science is clear. There is no scientific controversy about vaccine safety and vaccine effectiveness among mainstream doctors and scientists. Unsubstantiated beliefs regarding vaccine safety or effectiveness lead many parents to choose to opt out of childhood vaccination. And this would not be a problem for those in the mainstream who choose to have their children vaccinated if the vaccines were 100% effective, but they are not. And it probably would not be a problem if the small proportion of parents opting out of childhood vaccination was evenly geographically distributed, but they are not. Opting out tends to cluster. Although the overall opt-out rate is relatively low in California, some schools have opt-out rates of 10%, 20%, some even over 50%. This leaves pockets of children susceptible to preventable diseases, and resulting disease exposure leads to sustained transmission. The consequences are disease among those who choose not to be vaccinated, but also in those who are vaccinated, because remember, vaccines don't work 100% of the time. And in addition, there are those who are too young to be vaccinated, and they may be infected. There are several studies that show this, that increasing numbers of children opting out leads to more school outbreaks of pertussis, of measles, both among those who opt out as well as those who are immunized when the vaccine is not 100% effective. The recent measles outbreak illustrates this point. The measles vaccine works great. One dose results in about 93 or 95% effectiveness. 2 doses gets that up to 97%, but that's not 100%. When measles was introduced in Disneyland in December, it spread. The outbreak was amplified, fueled by those not vaccinated, resulting in their infection, but also infecting those who are vaccinated, the 3% that the vaccine did not work. The majority of cases in this measles outbreak were either unvaccinated or had undocumented vaccination status. Of those who were unvaccinated, over 40% did not receive measles vaccine because they opted out. Another 40% did not receive vaccine because they were too young or they had medical reasons not to be vaccinated. And thank goodness that there were no deaths due to measles, but make no mistake, measles can be deadly, with 1 death out of every 1,000 cases. In fact, more children have died from measles than any other disease. That's why SB 277 is needed. There is no scientific reason to opt out of vaccination. And opting out not only puts that child at risk, but the community at large also. Parental rights are important, but not all rights are equal. The right to individual and public health afforded by requiring vaccines for school attendance trumps a parent's right to make a choice that is not backed by scientific evidence. This is similar to other public and private health choices that the legislature has made. For example, requiring car seats for infants or wearing a seatbelt while driving. These rules are legislated because we believe that they are the right choice, even though some parents might not think so. Allowing the opt-out for childhood vaccination is the easy way out. Allowing parents the option to choose to have their unvaccinated child attend school is not as important as individual health, public health, and a safe school environment. We need to protect the rights of those who choose to vaccinate, to free them from the hazards posed to them from non-vaccinated individuals, just as we need to protect non-smokers from the hazards and annoyance of other people's addictions. This bill is not a radical step. This will put California with the majority of states, as 31 do not have the option for personal belief exemptions. Medical exemptions will remain, which of course is appropriate, to have a child's doctor determine whether a child has a medical contraindication for immunization, a conversation between the parent and the physician. In my role, I am happy to provide medical exemptions when it is indicated, when parents tell me about their child's contraindications. This is not a battle between individual health and public health. This distinction only makes sense if individuals are not part of the public. If children are going to school, are in public, we have a responsibility to ensure that they are hygienic and immunized. Those who choose not to vaccinate their children should not be allowed to take away other children's ability to safely attend school. Let's make daycare and schools safe for all children. I support this bill as an individual. The American Academy of Pediatrics in California, representing over 5,000 board-certified pediatricians in the state, supports this bill. The California Medical Association, representing over 40,000 physicians in the state, supports this bill. It is good policy and good government. Vaccines have saved more lives than any other medical intervention in history. SB 277 is good for public health, and it's good for individual health. I urge your support for this bill. Thank you.
Additional witnesses in support?
My name is Hannah Henry from Napa, California. Chair Bonta and members of the Assembly Health Committee, thank you. I am here today as co-founder of Vaccinate California, a grassroots volunteer organization of nearly 28,000 parents, grandparents, and community members who share in one goal: to protect our kids and our communities by increasing immunization rates in our state. The personal belief exemption is an artifact of a time when we collectively understood the need and value of vaccination. But as more and more parents have chosen their own schedule, their own version of the truth about vaccines, and as those people have clustered in like-minded circles, dangerous pockets of vulnerability have developed. You know about this phenomenon from the SB 277 deliberations. I know about this because I live in such a pocket. At first, it was just a discussion with my pediatrician when my eldest began school. We knew there were plenty of people around us who shunned some or all vaccines. But our kids, all medically able to receive vaccines, were protected. But then I became pregnant. And when I brought this tiny, fragile baby into the midst of my big kids, my perspective changed. It was 2012 when I looked up our vaccination rates, concerned about my newborn. I found a troubling trend. Since we had enrolled in our school in 2007, kindergarten immunization rates had steadily declined from an already low point of 79% to 62%. I talked to the administrator about parent education options. I appealed to our county director of public health, who agreed to speak to parents about vaccines. But the school was concerned about the controversial nature of the topic and declined the event. Now I can see why. Furthermore, I learned that AB 2109 had just passed. I was optimistic, along with my allies in public health, that this measure, with the intent of increased vaccination through education, would improve the situation for all. I am here today because the opposite happened. The next time I looked up the immunization rates in our school's kindergarten was when the measles outbreak occurred in Disneyland. I wasn't worried about my children at this point. I was worried about my community, that our school could become a portal for disease into our community. To my surprise, since AB 2109 had gone into effect, our immunization rates had dropped another 28 points, 49% fully immunized kindergartners. I understand AB 2109 has had some impact in some areas, capturing those who used PBEs because it was easier than going to the doctor, perhaps. But in other areas, something else is happening, creating an uneven landscape of protection for our children and our society. My baby is now 3, robust and wonderful, but I will never forget the acute worry I felt for her safety in my community. That experience bound me to those parents who, because of their perilous medical situations, never get to leave that terrified place. Among our most active members are critical care nurses, parents of immune-compromised children, and people who have suffered loss from the diseases we can now protect against. Before my kids were school age, one of them had a medical exemption for nearly a year. This was frightening, but our pediatrician assured us we could rely on our community, which had a very high vaccination rate, to protect our child. This vital shield for children with valid medical exemptions is undermined when personal belief exemptions are overused. People have a right to ignore science, but that choice is not without consequence. That choice is putting our communities at risk of vaccine-preventable diseases. We have modern medicine to thank for the fact that I can reasonably expect to raise all 4 of my children and see them into adulthood. This is a profound fact. Yet the parents of a child suffering in Spain from diphtheria this week say they feel tricked by the misinformation of the anti-vaccine movement. As lawmakers, you can't change people's minds, but you can change policy and make it harder for people to fall victim to the traps of bogus claims. In considering SB 277, please remember, personal belief exemptions do not save lives. Vaccines save lives. Personal belief exemptions do not protect our children and communities. Vaccines and the policies that require them for school protect our children and our communities. Our organization is not here to debate or defend the science behind vaccines. We are here to insist that science is honored over gut feelings, fear, and baseless claims. The thousands of concerned parents and families of Vaccinate California, as well as educators and the medical community, love and want to protect our communities, our schools, and our shared immunity. SB 277 is a common sense measure, a basic protection we need to restore in our society so all schools are equally safe for our kids and our communities. We urge you to vote for SB 277. Thank you.